I now recognize myself for questions. I want to point out, I want to ask Ms. Haskins, you talked about children with the learning disabilities or
Yes, sir.
other issues, or children and parents who are addicted to opioids. Have you seen any disparity demographically between children of people who are enrolled in Medicaid versus children who are not enrolled? Is there a greater population of children with these issues who are from homes where the parents are on Medicaid?
I would have to look at the school system for that, but just anecdotally, from what we hear in our community and from my observation, a large number of the children that are in that situation are certainly parents who are either uninsured or on Medicaid. But having said that, we also have a lot of children who are being raised by grandparents whose parents are very financially well off and able to provide whatever it is that they want, but because of their addiction, they're living with family members.
I understand, but the point that, and you've verified it, and it's consistent with the data that I've seen. There was a CDC study in Washington State that showed that persons on Medicaid are 5 to 7 times more likely to die an opioid-related death than someone not on Medicaid. You also see it that the opioid prescription rate among Medicaid enrollees is at least twice the rate for persons on private insurance. So you would naturally look at that data and conclude that some of the issues that you brought up about children having these learning disabilities would disproportionately come from households where they're on Medicaid. And I think that's a real issue with this. Mr. Siegel, Ohio enrolled more than 700,000 adults in the expansion of Medicaid, and is now seeing an unprecedented problems with opioid addiction. As a matter of fact, last year Ohio was on pace to have more opioid-related deaths than the entire United States did in 1990. That's one problem. I also want to know if you've also seen more trafficking of opioids from true Medicaid enrollees.
I don't know if I have any basis or statistics to support that one way or another. Most of the HIDA-funded counties in Ohio are centered in the major population areas. We only have one task force that operates down in Portsmouth in a rural area. And so I don't see, most of what I see coming from our interdiction efforts and enforcement efforts are in the larger metropolitan areas. And we're in 17 of the 88 counties, 14 of the 88 counties in Ohio. So in those rural counties, I really don't have a basis.
Well, it wouldn't be rural versus urban. It's more, are people getting prescribed opioids and then selling them? Is it, there are a number of issues here that are related to this, but we're seeing the same, we're seeing this across a number of programs where there's trafficking, whether it's a SNAP benefit card or an opioids that someone got as a result of a Medicaid prescription.
We're interdicting less pills and seizing less pills than before. Most of what we're getting now is the fentanyl, and it's actually overtaken heroin. So if you want to make a correlation, I don't know if you can, between less pills and more people on Medicaid getting pills, but we're seeing and seizing less pills.
Well, you mentioned fentanyl. It was recently reported that there were 3 people arrested who had enough fentanyl to kill everybody in Toledo. In my district, there was a gentleman arrested who had 38,000 lethal doses of fentanyl that he bought on the dark web and paid for it with Bitcoins. But Ms. Roberts, you're talking about it's produced in China. I would also add that the North Koreans are doing this. I was in a field hearing at Johns Hopkins Hospital with the former governor of New Jersey, Chris Christie, and I asked him if we've gone from a war on drugs to a war with drugs, and that the 70,000 or so people who have died from overdoses, are they casualties of this war? But it was interesting to me that when you talked about how it gets into the country, it comes in the mail, but it's largely coming across the border. And you only mentioned the Canadian border, and perhaps that's because Ohio shares a border with Canada. But I do think that this is the real issue of border security. And a lot of people lose sight of this. that we're in a war with drugs, and it's coming across the border. And the fentanyl issue, I think, is something that we're going to have to address outside of just drug policy, because it is lethal. Any comment on that? And Mr. Siegel, if you, in your efforts, where you
I would agree with you. It is coming across the border, and some of that is coming from China to Mexico and then up. And there's also a strong belief that the Mexican drug cartels are starting to produce their own fentanyl and transporting it up. But fentanyl, heroin, cocaine, all the major drugs are coming up from the southwest border into Ohio and most of the HIDAs. There's very little activity from other parts of the world. Some of the East Coast still see some from the Asia part of the world, but most of it's coming up through Mexico, at least in the Ohio HIDA.
Well, one last issue here, Ms. Ayala, is I've raised this question in the field hearing as well about the fact that hospitals have quality surveys that they provide for their patients, and one of those was on pain management. And when you're tying the federal government's reimbursement rate to the hospitals or to physicians based on the outcomes of these quality surveys, and you include pain management, that creates an incentive to overprescribe. And I think we can't address this whole issue of opioids without addressing that. And it's my understanding, and I hope they're doing this, that beginning the first of this year, they removed that as one of the criteria. Do you have any information about that? Any of you know anything about that? Have you seen any changes in that?
That is my understanding as well from our own Senator Durbin's staff. That is our understanding. The issue, however, is still with patient satisfaction. It may not be directly tied to pain management, but if I went to the doctor with the expectation of getting an opioid prescription and I left without one, then my satisfaction in general is going to be decreased. So I think that your point is right on, and we need to do additional kinds of analysis around those policies.
I would like to thank the witnesses again for appearing before us today. Are there any other members you wanted to ask one? Recognize the gentleman from Illinois for one.